That was the question. That is the answer. That'll have to satisfy for today.
So,
we'll be back soon. Thank you.
The governor and health director shutting today's press conference down, refusing to take more questions as reporters press them about why they won't release the names and locations of long-term care facilities with cases of COVID-19. Information that's being hidden behind health privacy laws. But lives are at stake here, with the majority of COVID-19 deaths in the valley coming from these facilities. And tonight, ABC 15 taking a strong step to end the secrecy. We're demanding the state of Arizona and Maricopa County release the names and locations of long-term care facilities with COVID-19 cases. We want the state to provide that information by the end of the day tomorrow, which we believe they are required to do by law. If they do not, ABC 15 is preparing to pursue this in the courts. Here's ABC 15 investigator Dave Biskobing about our fight for your right to know.
In the last day, there have been 5 COVID-19 deaths in Maricopa County. All 5 people, residents of long-term care facilities. Residents, families, they shouldn't have to trust that someone will notify them of an outbreak. That's information that should already be publicly available. And experts say it's unlawful for our officials to continue to keep it from us. The headlines speak for themselves. 16 deaths in a Chandler long-term care facility. 85 people sick in one Tucson home. In New Jersey, 70 people dead in a single place. In Maricopa County, 62% of COVID-19 deaths have come from residents of long-term care facilities, and that percent is trending up. So why don't you get to know which ones, where, and when?
The address or a facility where someone would live would be protected health information.
That's the repeated response we've gotten from state leaders when we've asked for names and locations.
And that it is protected health information, and so.
But other states are releasing it, and we interviewed a series of top experts who say our state is abusing and twisting health privacy laws, which only protect personal medical information.
It makes no sense.
Incredibly disappointing.
It's not infringing anybody's privacy.
Truthfully, I think it erodes the public's trust.
It is in the public interest to have this kind of basic raw data to assess how we're doing.
That raises 2 other reasons why knowing names and locations is important. One, it will allow all of us to look at a facility's history of issues before the pandemic. Were they cited for infection control issues? Were there other violations or concerns? And 2, it will also allow us to evaluate if the state effectively oversaw and inspected those facilities before the outbreak. See, Arizona has failed to properly and promptly inspect many healthcare facility complaints and violations in recent years. Arizona also failed to hold itself accountable after this 2019 homicide inside its own state hospital. It found no deficiencies when an unsupervised, unconfined, severely mentally ill resident repeatedly pummeled another patient, 83 years old, to death. But when it comes to long-term care facilities, state leaders are asking for your trust.
So we are working with the facilities so that they can notify the direct residents and their families who are impacted.
In press conferences, Dr. Christ and Governor Ducey say people will be notified if there are outbreaks.
If you have a loved one in one of these nursing homes and they contract COVID-19, you will be notified immediately.
But if you listen carefully, they said people affected will be notified. Our reporters discovered that doesn't necessarily mean other people in those facilities or their families or the community.
The real fear, if I were the government, is that I don't give the information to you. You find out later that I withheld the information and it could have saved a life.
I'm investigator Dave Biskobing, ABC 15, Arizona.
Again, our deadline is tomorrow, close of business, but it's not just the state, also Maricopa County. And we have a separate demand to the Department of Corrections. They are withholding the number and locations of prison staff who have tested positive. And experts say it's illegal to withhold that information as well.